Then according to modern, what all we can correlate, and samprapti also we saw, samprapti and samprapti ghataka. So symptoms, yes, so these are the common symptoms. So there will be heavy blood loss during the menstrual period, and even the duration also will be long beyond the normal cycles. Okay, that can also be there. Then bleeding or spotting in between continuously, the patient will be telling the complete stoppage or cessation, what cease of the bleeding will not be there. There will be continuous either spotting or bleeding for long duration. Then definitely abdominal cramps, then lower limb cramps. Then patient definitely will going for anemia is chances because of the lot of blood loss. Then fatigue, rasakshaya, along with rakta there is also rasakshaya. So definitely all these things, general debility will be there. Indigestion, constipation, then heaviness of the body, breast tenderness, mood swings and hot flushes, even vaginal tenderness. So these are the common symptoms. Again, coming to the types, we get the classical reference as Vataja, Pittaja, Kafaja and Sannipataja according to the dosha predominance. So likewise, so Vatakara Ahara Vihara will lead to Vataja. This one, I think we have discussed all these things in the last classes. I will be sharing the PPT also. These are all Charaka Chikitsa, 30th chapter, and shlokas are from 211 to 13. So these are the these are the types of the things. One is Vataja, then next is Pittaja, again Amla Lavana, Kshara, Kara Ahara, Pitta Kara Ahara. So how the Lakshanas will be are given. Okay, Daha, Trisha. See, along with the definitely bleeding pattern, everything will be according to Pitta, and along with that, some Daha, Trishna, Moha, Jwara, these kind of things will be there in Pittaja. Then in Kafaja, again, Kafakara Ahara Vihara leading to Kafaja, Asrakdhara. There, this Pichilatva will be there, Pandu Varna cha, Guru Snigdha cha Shitalam, Sravyati Asrukam, Sleshmalam, cha ghanam manda rujakaram. Then along with that, associated symptoms also chardi arochaka rullasa. So these things will be there. Then sanipataja, so combination of all these things. So in sanipataja, so all the rasas, so all the completely vatakara, Pitakara or Kafakara. So if they have told we should not take such cases, or few cases in Asrikdara are not at all treatable. So they are like Shashvat, Sravati, Yatasravam, Trishna Daha Jvara Anvitam, Kshina Raktam Durbalam Sa Tamasadyam Vivarjayet. So here, if there is continuous, even you are giving so many medications, in spite of that, still there is discharge. Along with that, if there is Trishna Daha, continuous discharge, there is no stoppage at all. Along with that, too much of Trishna Daha, then Jwara, and she is already anemic because of the previous, chronic, it is a very chronic stage, and she has been bleeding for a very long time. Then, and she is durbala, if the patient is durbala, it is incurable. So what I suggest is, even in your clinical practice, try to treat as much as possible. When really it is not at all possible, then only go for shastra chikitse. Nowadays initially only they will do hysterectomy, but as much as possible take the cases, try that, then only suggest hysterectomy. Don't directly suggest hysterectomy. Okay, then so what all investigations you have to do? Okay, these are the very basic investigation. You have to definitely check for HB. Go for complete blood count. Okay, complete blood count. Then few I don't know missed here. CBC. Then peripheral smear. Check her anemic condition, her blood status. then BTCT, any bleeding disorder is there or not. Then thyroid function test is very important. And most important is ultrasound scan, because to know the endometrial condition, whether there is any adenomyosis, any fibroids, or any other condition, underlying condition there. Then in the last, you can also go for diagnostic hysteroscopy. Okay, so these are the important. Again, you may need few more this one, but depending on the conditions. So they have told complications. Okay, complications of asrikdara. So these are the complications. Tasya ati pravritto daurbalyam brahma murcha tama tamah trusha. So daha pralapa pandutvam Tandra rogascha vatajaha. So Acharya Sushruta has given few complications because of asrikdara, definitely because of ati pravritti. Tasya ati pravritto. Because of the ati pravritti, there will be daurbalya. The patient will be very weak. So not at all able to, every time she will tell, I cannot, do the normal routine also. Then there will be Brahma, Murcha, Tama, lot of blood loss. Okay, and for weeks together, definitely she will have all these things. Tamaha, Trusha, then Daha, Pralapa. So even there, because of the loss of blood, so much of loss of, definitely her nutritional deficit will be there. The vascularity will be definitely less. Okay, so then Daha, because of too much of Pitta, Artava is Agneya, Daha will be there, Pralapa, definitely blood circulation also will be hampered, no? Because of the Ado, it is also like Rakta Pitta only. Then Pandutva, definitely anemic. Then Tandra, Rogascha Vatajaha. So Vata Roga. So again, too much of excess of bleeding, again Vata also will be increased. So it may end up with the any Vataja Vikaras. Okay. So next, then prognosis. They have told whom to not take. Sushruta has mentioned whom to take and treat, which cases to take. Tarunya, if they are young, especially preferably. Hitasevi, who takes, good, who follows healthy lifestyle and all. Then alpa upadrava. So associated with less symptoms. So such patients you can choose for the treatment. So coming to very, very important part, Chikitsa Siddhanta. Okay, there are so many cases wherein you give whatever, it will not come down at all. So it's become a very, very challenging, as challenging as treating PCOS, hypothyroidism, or infertility. So menorrhagia is also very, very common nowadays. Okay, especially youngsters. They'll be having a lot of stress, they'll be studying, or they'll be working for long duration. They cannot, changing the pads. They will be more stressed, more anxious. Okay, more frustration, more mood swings. So we have to ease, even because using of a lot of pads also, it's not so comfortable, not so convenient. There will be a lot of rashes in and around vagina also. Okay, so it will be very frustrating for them. So first and foremost, Nidana Parivarjana, ask the patient to just look in when you're taking the history. First and foremost is Nidana Parivarjana for any disease, then Dosha Shamana, then Dosha Shodhana, Basti Virechana Nasya, then also followed by Uttarabasti and Yoni Pichu. So not everything you can give in active bleeding phase. Okay, this is the overall treatment protocol which you can plan according to the patient. Okay, some might need Basti, some might need Virechana, some might need Nasya. Okay, in the next coming slides, I will explain the treatment in detail. So this you can plan as a Chikitsa Siddhanta. Acharya Charaka says in this is Charaka Chikitsa in Yoni Vyapatadikara. Okay, Charaka Chikitsa, 30th chapter. Okay. So he says the treatment, how the treatment of Yoninam Vata Lagyanam Yadutamiha Beshajam Chaturnam Pradaranam Cha Tat Sarva Karyet Bishak. So first and foremost, he says it is also treated like Yoni Vyapat only. Okay. like Vataja Yoni Vyapat, Vataja Pradara, like Vataja Yoni Vyapat, Pittaja Pradara, like Pittaja, like that. Chaturanam, Pradaranam, they told 4 types of Pradara, like 4 types of Yoni Vyapat respectively. Okay, so you should get back to the Yoni Vyapat again, brush up your Yoni Vyapat Chikitsa, then you will get the answer, one line of treatment there. Then second, he also goes on and says in the next shloka, Raktati Sarinam Yet Cha Tata Shonita Pittinam Rakta Arshasam Cha Yet Proktam Beshajam Tat Tatchak active bleeding phase only. Definitely, yes, right. They will not come after stopping of the bleeding. They'll come. I've taken so many medications. It's been bleeding. I'm fed up of this. They will come with you frustrated only. So immediately plan for Stambhana Dravya. Then Pitta Shamaka, Vata balancing Dravyas, and Rakta Prasadaka. Next is Rakta Prasadaka. Immediately Rakta Stambhana, then Pitta Shamaka you have to plan, and also control the Vata. Vata, there will be a lot of, aggravated. So you have to go for this one. What Stambhaka Dravyas. So even along with, before going to the medicines which you give, tablets and all. So one of the remedies, wait. So what common medicines I use in my clinical practice is Pradharantaka Rasa, Chandrakala Rasa. So these two are the foremost. Along with that, Bola Parvati also I use. So one more important thing, Godanti Basma. So rasa in rasa preparations. Okay. So what you can do is, I missed out here, one second. So in the remedies, so you can, very good combination is Pradharantaka Rasa. You can take around 60 tablets. Okay. You take around 60 tablets, crush it. Okay. 60 tabs. Okay. So you can crush it and make it a powder. Along with this, add Pushyanuga Churna. Okay. This is missed out. Pushyanuga Churna. So this you take around 50 grams. Okay. Then add Godanti Basma. Godanti Basma. Okay. This in proportion of 10 grams. Okay. So all in the powder form only. So give with, Pushyanuga Churna, Sahapana is honey, Anupana is Tandulodaka. Okay. So you can mix all this. Honey also, if you are getting only good quality, you can give. Because again, Pitta has to be taken care. If it is a really pure honey, it will act as Yoga Vahi. So very good. You can use with honey, or simple with the warm water also you can tell, if the patient doesn't have good honey, or Tandulodaka followed by Tandulodaka, you can tell. So this is one of the wonderful combination. And one more in my practice I will give is Amistop G. It's a patent drug which is a very good hemostatic, along with Durva Swarasa. Okay, Durva Swarasa, 30 ml. Okay. So here in South India, Durva is abundantly available in and around, I don't know about northern part of India. So Durva is easily available in your garden, or in, the common, places where trees are grown. So in the household only it is very easily available, and even in the market it is easily available. So what we ask the patient to, make a swarasa from Durva, wash the Durva properly, and you in the mixie they can take out the juice. It's very difficult to extract again. So 20 to 30 ml can be extracted. Then 2 capsules of Amistop, either BD or TID. So this is also will give very, immediate results. So this you can do. Then Ashoka Valkala Kshirapaka. So this, how to do the Ashoka Valkala Kshirapaka? If you get the bark, that is Ashoka Valka, that is Twak, that is very, very helpful. So how you can prepare is, you can you can just check the availability if it is there. Then you can because Ashoka Valkala, you all know Ashoka Arishta or Ashoka Churna, how helpful in the heavy bleeding, this one, excessive bleeding during menstruation. Commonly Ashoka Arishta, you all know, you have been using, but Ashoka Arishta cannot be given during active bleeding phase, because Arishta and Asava are contraindicated